So our next patient is Linda Belcher. She was born 9/4/1972. Medical record number is 139763. She has no known allergies and diagnosed with atrial fibrillation. Today she has a now dose for Coumadin, 5 milligrams PO daily for her AFib. And the order has been signed by Dr. Who, so we're going to go to the pharmacy and get our medications. And here's our pharmacy. And we're going to go Coumadin. Okay, so we've got our Coumadin, 5 milligrams PO daily for atrial fibrillation. And it's going to be for Linda Belcher, 9/4/1972, 139763 is our second check. And the lot has not expired, so medication's okay to give. So we're going to go ahead to her room and give her medication. We're at her room. Hello, Miss Belcher. My name is Nicole Simpson. I'm going to close the curtain for privacy, and I'm going to be your nurse today. So the doctor has ordered a medication for you called Coumadin, and it is for your atrial fibrillation. And so it's an irregular heart rhythm that you have, and we want to give you some medication to take care of that, okay? So let me go over your ID and do my third medication check. Linda Belcher, okay, 9/4/1972, okay, no known allergies, great. Medical record number 139763. Okay, great. So have you taken this medication before, Linda? No? Okay. So like I said, this is going to help so that you don't develop any blood clots associated with having atrial fibrillation, because that's a common cause of blood clots, okay? And do you have any trouble swallowing? No? All right, so we're going to have you just try some water there. Thank you. Okay, I'm going to hand hygiene again. Open the package. Come in. Have you take that. Thank you. And have a drink. Okay, thank you. How did that go down? Great. Alrighty. So something I do want to make you aware of. You want to try to avoid any falling or anything like that, because we don't want you to bleed, and something with this medication is what can happen there, okay? So you want to be very careful about doing that. If you notice any bruising, or if you have any pain anywhere associated with that, or any bleeding, of course, through urine, through stool, anything like that, please come back to the emergency room, okay? All right, any other questions or concerns? All right, thank you very much. So I'm going to grab all of my things. I'm going to chart, and that's it. Hi, so our next patient is Amy Farraflower. She was born 10/22/1967. Her medical record number is 741852. Her diagnosis is fluid retention, and she is allergic to penicillin. She has a now dose for today, Lasix, 20 milligrams PO daily. And the order is signed by Dr. Who. But if she is having active symptoms of the fluid retention, we want to see if the doc will maybe change the order to IV Lasix, and then we can push that slowly over 2 minutes. So I'm going to get on the phone, call the doctor. Doc, she is having active symptoms, crackles. I checked with the stethoscope here, and I think we need something a little bit faster to work to get this fluid off of her. Okay, great. We'll take it from the IV. Thank you. Hang up the phone. And now we're going to go over to the Pyxis, and now we're going to get 20 milligrams in the IV for Lasix. So we're going to go over to the Pyxis. Okay, so now we're at the Pyxis here, and I'm going to put on some, well, let's check the order first. Okay, so we've got Lasix 20 milligrams IV for Amy Fowler, 10/22/1968, medical record number 741852. So we're going to do it here. Okay, so this would be the medication. The lot is not expired, so we're okay there. It's 20 milligrams. So now I'm going to get my IV and draw that up in the syringe. So I'm going to put some gloves on. And I got a vial here. Some alcohol, because we got to clean the vial. Of course, after the lid is popped. Okay. Now we're going to open our syringe. We're going to do the bunny ears. Take it out of the package. Pinch. Get some air. And then we're going to stick this straight in. Push the air, turn it upside down. And we're pretending to pull up the medication here. Okay. And then we're going to recap. I know we're not supposed to, but we would be changing out the needle, okay? And then we've got the medication, and now we're going to enter into the patient's room. Knock on the door here. Close the curtain for patient privacy. And I'm going to use hand sanitizer. Hi, are you Amy Fowler? Farrah Flower? Yes, okay. Thank you. Well, I want to go ahead and confirm your information here. And let's see, your name is Amy Fowler, yes. Born 10/22/1967. We're doing our third medication check. Medical RN number 741852. Allergic to penicillin. Okay, I'm going to go ahead and kind of reassess from what I heard earlier. Okay, come around back. Take some deep breaths for me. And again. And again. On this side. And again. Deep breath. And over here. Thank you. One more here. Okay, now breathe normally. Okay, thank you very much. So yeah, you do have some fluid there in your lungs, and I see that your extremities are a little swollen. So we're going to go ahead and give you, per the doctor, Lasix. Have you ever had that before? So this is going to make you urinate quite a bit, okay? And I'm going to give it to you in your IV, and I'm going to push it over 2 minutes very slowly, okay? And I think that's about it right now, okay? So we're going to clean your IV site. Okay. Screw this off because then it'll screw into here. And I'm going to push over 2 minutes. Okay, 2 minutes is done. Recap this right now. Okay. Okay, so I will get you a commode. Is that okay? I think maybe that would be the best thing for you to urinate in, because you're gonna have to go quite a bit. Is that okay? All right, we're gonna keep an eye on your blood pressure and your heart rate, making sure everything is okay there. And do you have any questions at the moment? Okay, great. I am going to give you your call button there, and if you need anything, please don't hesitate to check, okay? Don't do anything with the urine if, in the commode, because we're going to be checking how much output that you're going to give us. Okay. All right. Thank you very much and stay well. See you soon. And then I'm going to chart. Okay. Okay. So for my next patient, I have Taylor Swift, born 7/21/1980, medical record number 8675309. And she has been diagnosed with angina. We have brought her back to the room. We have taken blood pressure. We have gotten her EKG. We have gotten a line. And then I will go in while all those people are doing that, retrieve the medication. And the doctor has ordered a now tab of nitroglycerin sublingual and also now ½ inch of nitro paste. She doesn't have any allergies, and Dr. Who signed the order. So we're going to go in quick to the medroom. And we're going to get all of this stuff together here. I don't know if you can see that there. Okay, so I'm going to put some gloves on because nitro is not something you want to deal with. I had that happen once where a nitro bottle, old school, cracked, and yeah, let's say that was fun. Okay, so we're going to do a double check on the medication here. So Taylor Swift, 7/21/1980, medical record number 8675309, diagnosis angina. We're going to get one nitroglycerin tab and ½ inch of nitro paste for right now, and everything is okay with the expiration. So we've got our nitrogen right here, just pour it in there, very small tube, and then we're going to do a ½ inch of nitro paste on the opposite side here, ½ inch. I don't know if you can see that real well, but putting that on, I can get it to come off. Okay, so I'm going to need a piece of tape. I thought I had some tape, but okay. So now we're going to go into the patient's room. Hi, Miss Swift. How are you doing today? My name is Nicole. Close the curtain and sanitize. How are you feeling right now? Okay, so and let me verify some quick information from you. Okay, can you tell me your medical or your birthday? 7/21/1980, and your full name, Taylor Swift. Okay, great. Are you having any pain right now? Okay, you are. Okay, on a scale of 1 to 10, what's that pain like? An 8. Okay, so we're going to go ahead then. I'm going to give you, this is called nitroglycerin. We're going to put this under your tongue so it dissolves. I don't want you to chew it or anything like that. Just let it dissolve naturally on its own. Okay, so I'm going to give you that. And while you're doing that, while that's dissolving, I just want to let you know that it may give you a headache, okay? So just be aware if that occurs. Right now we're checking your blood pressure and your vitals continuously, okay? EKG seems to be okay. So we're going to be right here with you while that all dissolves, okay? And while that is dissolving, we're going to put on a nitro paste also. The doctor has ordered a ½ inch of nitro paste right now, and it's going to go right here. It'll stick. Yay, it's stuck. Okay. So again, you're going to get a headache, perhaps. We want to resolve your pain, okay? And we're here for you. Don't worry, everything's going to be just fine, okay? Okay, so it's been a few minutes. How are you doing with that pain? It's down to 1. Oh, great. Well, we want to get it to 0, but I don't think we're going to give another dose, okay? We're just going to hold off for a minute, maybe see if that gets a little lower. Anything else going on right now with you? Okay, so we're going to continue monitoring you, okay? We're going to check your blood pressure regularly, your heart rate regularly. Blood work has already been done and sent down, so we're going to be waiting for those cardiac enzymes, the BNP, the CBC, Kim, all those things like that. And no reproducible pain, okay? And anything else going on? Are you feeling a lot better? Okay. All right, great. So I'm going to give you the call button, but somebody's going to be here with you. And now I'm going to